Hi, welcome to the Shades of Motherhood Network. I am the Executive Director, Stephanie Courtney. I would like to thank you so much for coming to our online conference, Stronger Together, Community Care for Black Maternal Health.
Our guest speaker today is Dr. Melissa Mace. Dr. Melissa Mace is based in Spokane, Washington, and is a champion for mental health and changing the perception within her community. In June 2009, Dr. Mace started a small private practice that blossomed into Discovery Counseling Group. 3 years later, Dr. Mace's mission is to celebrate the journey we are all on to self-discovery and personal empowerment. She continues to advocate for diversity within the mental health field, opening the doors for more people in the global majority. Dr. Mace's overarching goal is for those DCGs to feel welcome, seen, heard, and supported in their journey. Welcome, Dr. Melissa Mace.
Hi, we're going to talk about the importance of reflection, why seeing yourself in service providers is imperative. As we all know, the research has for many years told us how important it is to see ourselves in our environments. So that was like the grocery store clerk at the bank, and especially important to see yourself in those who provide such important services in your life. So your physical doctor, your mental health provider, and any maternal health providers that you see. If you are not reflected in those populations, they miss subtle nuances and things that are vital to your care, quality care. So as we talk more about gaining insight into culturally sensitive approaches, let's talk about access. What does it mean to access mental health services? There are several barriers that block most Black women and people of the global majority from accessing mental health services. We could just list a few. So let's think about the stigma surrounding mental health services, racism and race, understanding the language, expression and presentation of symptoms, the role comparison plays in our culture, and the idea of failure. So like not living up to this persona that people place on us most often. So like let's talk about, because I just name dropped a couple of things. So let's talk about let's unpack those things. So let's talk about stigma. Stigma is the negative feelings, the negative connotations surrounding something. So if we think about mental health, in the culture for most Black people and those within the global majority, we are taught at a very young age not to put your business out. Family business is for family. Keep what's in this house, that kind of thing. And the idea that if we went out and told anybody what was going on in here, we could get in trouble. The list goes on and on. But we don't want to tarnish. And then the other side of the coin is we don't want to tarnish the idea of a strong Black woman or a strong Black whatever, or strong people of the global majority. And that falsehood needs to be stricken, because as a people, we are so much more. And we all have a desire to be many other adjectives. I would like to be known as soft. I want to be known as loved. I want to be known as helping, a helper, comforter. I want to be supported. I want to be brave. I want to be tearful. I want to pick an adjective. That's what I would like to be, other than forced to be strong. Let's talk about race and racism and how that plays a role. In our everyday life, we deal with managing microaggressions or subtle acts of exclusion, and which is our favorite, blatant acts of racism. And understanding how those things are slowly killing us, because there are things that we have to deal with every single day. And there are many times that when the microaggressions, the subtle acts of exclusion, you're thinking about it all day. You're like, was that about me? What did I do? And so you're ruminating over these terrible things that people do to you that nobody has said anything. Hopefully you're with somebody who you can bounce it off and be like, did that just happen to us? Oh my goodness. And then you can talk about it and process and move forward. But a lot of the times you're by yourself. And so you're ruminating over these things, and you walk through this life feeling attacked and unsupported and unseen without reassurances or acknowledgement of the pain and the struggle that you deal with every single day. Let's shift to the power of language. I always say that the way that you speak, the way that you move, the way that you listen has to be a common vocabulary between those who you invite into your life. Because if I'm speaking in a way that you don't understand, you cannot hear me, then nobody is successful in this relationship. So if I have to think before I speak, or I have to figure out, how will you best understand, and how will I best get my point across to you so then I can get my needs met, then what else are we working on? There's no room to work on anything else, because we're just too busy trying to figure out one another to then not get to the real root of the issue. Let's talk about symptom presentation. So a lot of the times, people within the global majority, the common diagnoses for people, depression, anxiety, present in a certain way per the DSM, the diagnostic manual. And for people within the global majority, Black people, it presents differently. And so if your provider is not culturally sensitive, or they don't have any perspective of what it looks like, you could come in and you can be complaining about your back. You could be complaining about this pain that you have on your shoulder and your neck. It's like real tight. They will miss that. Yeah, that's a sign of anxiety. That could be some depressive symptoms. Just because you are able to function every single day, and you go to work and you go to school and you got that promotion, and your kids are rocking it out, and et cetera, doesn't mean that you're not suffering. And most of the time we suffer in silence until it gets too big. And then it's critical. And if we would have taken that small step just to come and talk to somebody before we got to that point, it would have been so much better for all of us involved. So we're going to move on to comparison. What's for me is mine and will never be yours. And what is for you is yours and will never be mine. We have been brainwashed to be divided. Since Black people had been stolen and raped and tortured in America, they have worked diligently to lie to us and brainwash us to believe that there's not enough room for all of us, to make us believe that we are not good enough, that we are not amazing, that we are not capable, that we are not the most magnificent people. And comparison is the thief that blocks us from our greatness. The idea of failure. Failure is another lie that blocks our growth. Because how do you know if you're good at anything? How do you know if you have never tried it? We can't, like, I know that we are pretty magnificent people, but you got to try it sometime. And not every single time is great. So if we fall back onto that language thing and we work on redefinitions, and if we called it areas of growth, that's what I like to call it, because that's the lesson that I learned. I learned what I don't like. I learned because every role is not for everyone. That is why there's lots of us. And so the things that I'm really great at, there's somebody else that's really great at the things that I am not fantastic at. And so if we work together, oh my goodness, look at what we can accomplish. So let's think about what are the first steps of modifying perception of mental health. So one of the first things that we could do is diversify our practices. Have more people of the global majority who provide mental health services. Then as we indoctrinate ourselves into the practice, we can pour in to more people who look like us. We can make mental health a safer space for our people. And so they can feel comfortable coming and talking and laying their burdens down as we practice, even just for this 50 minutes. And so then we can eliminate the us versus them dynamic. As the more that we talk, the more that foundational information is disseminated, the better that we will all be. Providers outside of the global majority have to be, it's imperative that they become more comfortable talking about race, racism, and the effects that it has on Black people and people of the global majority. It is not a conversation that is hard or difficult, because for us, it's a conversation that you have every single day in most areas of your life, with your kids, with your grandma, with your parents, with your partner, with your friends. I am Black before I'm anything else when I walk into any room that I'm in. That is not a difficult conversation for me. It is not a difficult conversation for those who look like me. And so I shouldn't, if I'm coming to you for assistance, I shouldn't have to worry about how comfortable you are when you are supposed to be making sure that I am good. And that should reflect in the treatment, our treatment plans, our modalities that are chosen, the connections that we develop, and the outcomes that we're working towards. So what difference would this make in your therapeutic relationships? Having an empathetic provider offering care and supporting you through your birthing process, through struggle, any mental health struggles, physical struggles, would be a game changer. The comfort level of being seen and supported wholly, oh my goodness. It would lift the weight off your shoulders and allow you to then focus on the things that you need to focus on, because you get to show up as your authentic self first. And you get to worry about birthing your beautiful little baby. You get to be like, I'm a mother right now, and I'm going to go through this process, and I don't have to worry about proving anything to anybody. Black women don't often have the luxury of being soft or saying that they need help. And as a provider, it is your job to allow your clients to feel safe and supported while they're in your care. So, to wrap everything up, it is imperative that Black people and people of the global majority are represented in the service industry and the service provider role. The more that people see Black doctors, Black clinicians, the better our health will be. Thank you for your time.